Psychiatric hospitals in Montreal and Quebec City say they've seen a rise in patients with suicidal thoughts. And it's more young people, some just 10 years old. Dr. Tamara Soles is a child psychologist and she joins us now. Thank you so much for being here today, Dr. Soles.
Thanks for having me, Kelly.
So what do you think is driving this?
First of all, I want to start by saying it's incredibly alarming, and it's a rise that we're seeing in our clinical practice, but really all around the world. And the increase in child distress is happening globally, and we do need to be concerned about it. Now, there are many things that are underlying this, one of which is the increased pressure that many kids feel, whether that's academic pressure, social disconnection, screens, the lack of time with family and friends, and also the lack of time out and about in the world, moving their bodies, and decreased sleep. So all of these things put kids at an increased risk when it comes to their mental health. And it's something we need to look at in a macro level to figure out how we can reduce these alarming statistics.
Yeah, you describe them as alarming, and according to research from Quebec Public Health, the number of hospitalizations for girls aged 10 to 14 with suicidal thoughts has tripled since 2010. Do you think that's going to continue to rise?
Unfortunately, without some pretty significant shifts, including better access to care, those numbers have been steadily on the rise even since before COVID. So at the moment, there is unfortunately no reason to think that that rise is going to decrease. It is important to know that young people with suicidal thoughts and making suicidal statements do not necessarily have a wish to die. Often for young people, they lack the vocabulary to describe the level of distress that they're experiencing. But having said that, every comment or statement about a wish to die or a desire not to be here anymore needs to be taken seriously.
Yeah, to that end, I mean, going through puberty, even if they're not going through puberty, but it can bring different emotions out in teenagers, moodiness, sadness. But how do you know when it's more than that?
Yes, that's a great point. So we notice moodiness happens, especially for, children going through puberty. But at the same time, if you start to notice a difference in your child's eating habits, and it can be in either direction, significantly more or significantly less, or their sleep patterns in the same direction, either way, or they stop showing interest in the things that normally they're interested in, or stop wanting to spend time with family and friends, those are signs that we should take seriously. And of course, if your child makes statements like, I don't want to be here anymore, or I don't want to do this anymore, we need to take those seriously.
We spoke a little earlier about the challenges. Is there a difference between what it's like for boys or girls at this age?
Yes, given that girls are hitting puberty earlier and earlier, we're seeing the onset of some of these mood symptoms sooner as a result. But there is increased pressure for boys now as well. So we used to often talk about the pressure on girls when it came to body image and their weight and dating and all of those things that kind of come up in this age group. But more and more we're seeing that for boys as well. So it's not exclusive to girls.
And you touched on it a little bit, but is this a reflection as well of a lack of resources available to young people, possibly through school or other means, that they get to that point?
Yes, certainly there is a lack of resources. Even in a bigger city like Montreal, we have long wait times, even in private practices, unfortunately, for much needed mental health services. And we need to think about ways to shift the system so that mental health information and resources are available more widely and community-based and in schools more effectively. So that is an important part of reducing the distress that so many children and teens are feeling.
All right. Dr. Tamara Soles, thank you so much for taking the time today. Certainly useful for a lot of parents to know. We appreciate your expertise here.
Thank you for having me.